This topic probably is the thing that I'm most passionate about. Changing the game in breast cancer risk. I truly believe that we have the facilities, the capacity, the knowledge to change women's risk of breast cancer significantly. But a lot of that currently resides outside of conventional medicine. Question, is this the best that we can do in modern medicine to protect women? Is that if they have a genetic risk, remove the breast tissue and remove the ovaries. Really? Cancers in women have increased by 41%. Prostate cancer has increased 100%. And breast cancer has increased 80% over the last 40 years. So that is not winning the war against cancer. The latest published science of large numbers of screened women does not support that mammography is saving lives. In fact, what it's showing is that it's leading to women being overtreated. Approximately 2 years ago, based on a peer review group reviewing all of the evidence, including an oncologist, a breast surgeon, epidemiologist, nurse practitioner, lawyer, reviewed all of the data for 1 year. Then they concluded we can no longer justify offering mammographic screening to our population in Switzerland because it does more harm than good. So I think from what I've said so far, you can see some of the dilemmas that surround the story with mammography and why it's not proving to be a successful screening tool. Thermography is looking for heat coming from the breast tissue. This is my own system that is a computer-assisted thermography system called Thermocheck. So let's now talk about how we can change risk. And then right at the end, I'm going to show you how I am and my staff are changing risk in women. Okay, and that's the thing I'm most excited about. So a lot of these women who have abnormal thermograms, because it's early detection, you send them for a structural scan, comes back normal. So conventional hat says, nothing to worry about, off you go. We'll wait until something shows on the mammogram, then we'll react. Well, for me, that's an ethical dilemma, knowing what I know. Because if these women are truly at risk, I don't want to wait until something shows structurally in that woman. I need to be proactive and advise her what she can do to take herself off that high risk and normalize her thermogram. Would you agree with that? About 6-7 years ago, I developed something called Breast NutriCheck, which is, as the name suggests, it's a home kit test which allows women to test certain key nutrients, some of which we've already mentioned, from their own home. We have doctors from India interested, we have doctors in Europe interested in having this. Now I propose to you that is the way to change the game with breast cancer risk. Non-invasively, non-toxic, non-hormonally, intervening with only key nutrients and important lifestyle changes, and within 6 months, and I'm seeing this, 95% of abnormal thermograms are returning to normal. One of the things I would do is optimize women's vitamin D and their iodine levels. And if they just did those two things, I believe they would significantly reduce their risk of breast cancer. Look at this differently. How do you not monitor if a woman has a tumor that you can see, but how do you monitor whether that woman's breast tissue is healthy or not? And then, if it's not, you intervene non-invasively and change it. And that, for me, is a big story, because I think this will lead to a change in the incidence of breast cancer. That's who I am. That's the name of our practice.